Let me recap here. Common diet for defined disease. Like acute renal problem, patient need what? Need the protein restricted or high calorie diet. And Addison disease, patient need the increase the sodium and low protein diet. So acute renal patient or chronic renal patient, both patient need same kind of diet. Let me here, it is a chronic renal disease, protein restricted, low sodium, and also fluid restricted, potassium restricted, phosphorus restricted. If patient has ADHD or bipolar, it is good to give them the high calorie and provide finger foods. This is the question NCLEX products. If the patient came because of burn, what kind of food you're supposed to give them? We give them high protein, high calorie, and increase vitamin C. Any cancer patient, good to give high calorie, high protein. In case of celiac disease, give gluten-free diet. Gluten-free diet, easy to remember. No, BROW. B for barley, R for ray, O for oat, W for wheat. And what next? Next here, if patient got hospitalized because of cirrhosis, give them normal protein. If patient have a cirrhosis with hepatic insufficiency, give restricted protein, fluid, or sodium. If patient have a constipation, we give them high fiber and increase enough fluid. In case of COPD, chronic obstructive pulmonary disease, soft, high calorie, but low carbohydrate, high fat, small and frequent feeding. Cystic fibrosis, lung, genetic defect in the lungs and endocrine system like pancreas, even the gastrointestinal tract. Increase the fluid. If diarrhea, loose motion, liquid and low fiber, and low residual food means the food that are low in fiber and easy to digest. Also fluid and electrolyte replacement. In case of gallstone, gallbladder disease like cholelithiasis, give them low fat and calorie restricted. In case of gastritis, means stomach problem, low fiber and blend diet. Blend diet for the patient who have gastrointestinal problem like colitis, Crohn's disease, or gastritis. If patient has a problem in the liver, what kind of food we will provide them? We provide them regular high calorie, high protein. You see, high calorie, high protein. Hyperlipidemia, cholesterol is too much, give them fat controlled, calorie restricted. If hypertension or heart failure or CAD, in that cases, we provide them low sodium or calorie restricted and fat control, means fat restricted. In case of kidney stone, we give the increase the fluid intake, and also calcium control, low oxalate. They increase the stone. In case of nephrotic syndrome, sodium restricted, high calorie, high protein, and potassium restricted. Obesity, overweight, what you should prefer for them? We prefer for them calories restricted and high fiber. If the patient has pancreatitis, low fat, regular, small, frequent feeding, or tube the feeding, or total parental nutrition, TPN. If patient has a peptic ulcer, always provide blend diet. As I told, blend diet for them if the patient has a gastrointestinal problem, like peptic ulcer, like colitis, like Crohn's disease. If patient has a pernicious anemia, we give them, increase the vitamin B12. It is called cobalamin, or fluid, high the amount of seafood like shellfish or beef liver or fish. They contain a good amount of vitamin B12 content. What next? And sickle cell anemia. If patient have a sickle cell anemia, we provide increase the fluid to maintain the hydration, since the sickling increase when the patient become dehydrated. When patient dehydrated, their pain will be increased. So hydration is only way to prevent them from acute attack. In case of stroke, we provide mechanical soft and regular tube feeding. So soft food, someone difficulty of chewing. As I told you, any kind of food is considered soft except nut and seed. Under the weight, high calorie, high protein. If the patient have been vomiting, you provide them fluid and electrolyte replacement.